Since we have discussed the beta-lactam antibiotics, let's proceed to another drug under the beta-lactam antibiotics. Cephalosporins, which have a 7-amino-cephalosporanic acid nucleus analogous to the 6-APA nucleus of penicillins, they are weak acids and administered as a sodium salt monohydrate or free base. This antibiotic is isolated from the fungus Cephalosporium acremonium and discovered by the Italian pharmacologist Giuseppe Brozzu. Mechanism of action of cephalosporins are bactericidal, which inhibit the third stage of bacterial cell wall synthesis, the cross-linking of the peptoglycan chain by the same mechanism as the penicillin. Therapeutic uses of cephalosporins may be used in penicillin-intolerant patients, but this should be done with caution since cross-reactivity can occur. Cephalosporins are categorized in 4 generations. First generation cephalosporins include the cefalexin and the cefadroxil, which administered orally, and cefaferin and cefalutin, which administered parenterally. They are effective against gram-positive aerobes and drug of choice for urinary tract infection. First generation cephalosporins have no activity against Enterobacter, Pseudomonas aeruginosa, and Sriracha species. Second generation cephalosporins include cefaclor, which administered orally, and cefoxyctin administered parenterally. Their antibacterial spectrum is broader than first generation cephalosporins and includes some gram-negative pathogens, but they are not widely used in veterinary medicine. The third generation cephalosporins are active against gram-negative but ineffective against Enterobacter and Sriracha species, and a drug of choice for bacterial meningitis caused by Enterobacteriaceae. Drugs included are the ceftriaxone, cefoperazone, cefotaxime, and cefodoxime, which administered parenterally, while the cefexime administered orally. Lastly, fourth-generation cephalosporins are active against both gram-negative and gram-positive bacteria. These include antibiotics like cefepime and cefquinone, both administered parenterally and have more activity against bacteria, particularly Pseudomonas, showing resistance to cephalosporin. The route of administration in the acid-stable cephalosporins are administered orally and parenterally. Cephalosporin are administered intramuscularly, intravenously, and subcutaneously. Hypersensitivity and allergic reaction may occur as an adverse effects. Side effects are rare and cephalosporin are considered to be among the safest antimicrobials in use, but prolonged treatment or high doses may produce hematopoietic effects with anemia and bone marrow depression. Hope you learned something on cephalosporin under the beta-lactam antibiotics. Thank you for watching!